is a new year, and a lot of people are focusing on their health in 2024. Dr. Bill Hartman with UW Health joins us, and I want to start with some things that many of us can do proactively to stay on top of our health. Dr. Hartman, what sort of screenings do you recommend people of various ages should be getting routinely?
Well, this is something that you should probably discuss with your primary care doctor so you can assess your risk level for different cancers. But the ones that we should be able to do screens for, and we should think about getting screens for, include things like annual mammograms that should start at around age 40, cervical cancer screening, especially for HPV, colorectal screening for colorectal cancer can be done with something like Cologuard, but even better with a colonoscopy. That should start around age 45. Prostate cancer screening, you can get a PSA really at any time, but for people at risk, for men at risk, probably should start around age 40. And lung cancer screening, we have better lower radiation CTs that can be used to screen patients for lung cancer. These are all cancers that if you get on top of them very early are very treatable, and people live many, many years beyond their diagnosis. And so really getting ahead of these things, planning to get these screenings done at the appropriate time is really important to keeping your health in check for quite some time.
And the medical technology has just gotten better and better and better over the years. So there's a lot that exists out there for all of us to try to stay safe and healthy as best as possible. Let's kind of talk about the other end of the age spectrum for a moment here. There is a new concern about some baby formula being contaminated with a bacteria similar to what happened 2 years ago when there ended up being a baby formula shortage. Can you talk more about what parents of infants need to be aware of here?
Sure, and these are cans that have been shipped over from Israel. And the problem is that within Israel, these baby formulas were found to have the coronabacter in the cans. So far, in the cans that have come to the United States, there hasn't been any detected. But out of a predominance of caution, they've pulled these certain baby formulas from the market. The coronabacter, as you remember, is the same one that triggered that Abbott recall in 2022. So this is something that's very significant. It's something that is very important to making sure that your babies are staying healthy, but it also can contribute to these shortages in baby formulas that we see.
And if any parents at home are worried, thinking that they use that specific type of formula, we have the specific lot numbers that are impacted on our website, so make sure you visit fox6now.com for that. Lastly, I want to ask you more about this triple threat of respiratory viruses. It is back. We talked a lot about this in the fall of 2022. RSV kind of seems like it's the headline right about now. What are the biggest concerning things that you're seeing?
So with RSV, you can get really, it feels like a real tightening of your chest, and it's a profound tightness that you feel in your lungs. It's very difficult to breathe, especially in our older population, people over age 65, and our very young population, our infants and toddlers who haven't been exposed to RSV before. This is still a very significant virus that can cause bad things to happen, including hospitalization, even death. And so there are RSV vaccines available for people over the age of 60 and even for mothers who are pregnant so that they can at least expose their kids to RSV through the virus so that they'll be able to develop antibodies and help fight off serious infection.
Oh, we just need to get through this season. I know it's been tough for so many families out there, and we are certainly not out of the woods yet. Dr. Hartman, we always appreciate the insight. Thank you.
Thank you.